Hello and welcome to our Friday webinar with Dr. Stephanie Lamb. Welcome, Dr. Lamb.
Hello.
Yay. Let's see, as people start funneling in, let's see here. Okay, so today's topic is aspergillosis. So important topic, and I'm sure we'll have some questions and all that good stuff. So I'll let people funnel in here. Let us know where you're coming from. We want to know, I love to see what cities people are joining us from. And weather reports too are good because right here we went from mild weather and now we're going to scorching hot here in California. Like
What's the
it's
temperature out there in California?
well, it's forecast on scorching hot. I guess that's relative. It's supposed to be in the like 90s today, which
Oh,
yesterday
okay.
we went from like the 60s to like the 70s. All of a sudden it's like hello 90s. So yeah.
Yeah, we were down in the low 70s, and then yeah, we're bumping back up. And I think tomorrow or maybe in the next few days it's supposed to maybe hit 100. We'll see.
Wow. I remember there was like a study on lovebirds in Arizona where they found that they hang out on air conditioned vents like in the summer heat to cool themselves off.
Yeah,
The
yeah.
wild lovebirds.
They're interesting because where they seem to like to nest a lot is actually in the palm trees. So like in the palm trees, like between the like pieces of old dead palm leaves, like you'll see them coming out of those little like corner pieces.
Oh, interesting.
Yeah, must be a really good spot. I mean, it's high up, right? So like
Yeah.
nobody can get to it unless you're a tree climber.
Yeah, and then you got some nice shade going, I'm sure.
Yeah.
Interesting. Okay. Okay. Oh wow, yeah. So we got people coming from all weather events going on across the country. We got rain in some places and heat in others. Um, all right. Okay, I have a feeling this is going to be a lot of territory to cover in this space of time. So aspergillosis, I'm gonna let you take it over now. So
Okay.
the screen share, right? I imagine.
Yeah,
I,
I'm going to be sharing my screen here. So let me just get that up. Screen share. Okay. All right. So, as you mentioned, we're going to be talking about aspergillosis today. Just one of the infectious diseases that we're taking a deep dive into that we see with some frequency in our avian patients, more so than we see in other species. Other species of animals aside from birds do get aspergillosis. It's just birds are the most common ones that get aspergillosis. So let's find out more about this disease. So what is aspergillosis? Well, it's a fungal infection, and I shouldn't even say that. It's a fungal organism is what aspergillosis is. It's a fungal organism that's really common out there in the environment. And I've written down it's ubiquitous in the environment. And what the word ubiquitous means it's everywhere. So everybody who's on this webinar today, sitting in their homes right now, there's probably some aspergillus spores in the room that you are sitting in right in this moment. It's normal. They're tiny. They're just part of our environment on land. Where they actually aren't so much is over like aquatic environments. So if you really want to have no aspergillosis, you got to go somewhere off of land, essentially, because on land, they're pretty much everywhere. I can pretty much guarantee that if we were to swab this room somewhere that I'm sitting in right now, we'd probably find it somewhere because they're just that common. And there's a lot of aspergillus species that are out there, and some are really benign, and some have a greater potential to be problematic and result in infections. Now, certain environments do tend to harbor the organism more, with one of those things being damp environments. So a damp environment, like a area where there's maybe been a bit of rain, poor air circulation, and maintaining a little bit more moisture, even though they don't like to be over like water. They do like a nice land environment where that is damp. Again, like I mentioned, poor airflow as well. If you don't have great airflow in the area, it tends to kind of want to hang out and stagnate in areas. It can also be present in feeds, so animal foods, that haven't been stored properly. If you have an animal food that is maybe stored in a bin somewhere where it's like closed in, and if there's some moisture gets into there, well, you can create that nice moist environment that doesn't have great airflow, that a few little fungal spores are in there. They like that kind of environment, they take advantage of it, they overgrow, and you can get a fungal infection, or fungal overgrowth, I should say, in stored feed. Now, I also put the word peanuts on there with a question mark next to it. I just want to take a moment to talk about peanuts for a second, because peanuts are one of those things that bird owners will hear all the time about how Aspergillus is on peanuts. And where the Aspergillus spores actually are is like in the peanut shell. So if you get a peanut that's in its shell, not a loose peanut, but like a peanut inside of its shell, in that shell, there can be Aspergillus fungal spores on the shell, inside of that shell. So generally speaking, people usually recommend against feeding shelled peanuts to pet birds because of the potential for Aspergillus fungal spores to be sitting inside of that peanut shell. If you have a peanut that has been shelled, you've taken the shell off of it, and then if it's, you know, usually in a store that's like a human grade peanut, those have usually been treated in some way. You can use like UV light or other things that can help to sort of disinfect any fungal spores that could potentially be on there. So peanuts that are outside the shell, that are human grade, are usually going to be safe. We don't have to worry so much about Aspergillus on those. It's the ones that are in the shell that are thought to be more the problem. And even then, the important thing that I just want to mention is it's not so much that the Aspergillus fungal spores that are in there are likely to cause Aspergillus for the animal that eats it. It's actually, the problem is that those Aspergillus fungal spores can produce a toxin, and that toxin, when the bird eats it, could potentially be problematic. And what that particular toxin is, it's called aflatoxin, and it can have side effects on their liver. That's kind of a completely separate thing from what we're actually going to be talking about today, because we're really going to be talking about what happens when the bird gets an infection with Aspergillus, not what happens when it eats Aspergillus and that Aspergillus happened to produce toxin and that toxin causes problems. That particular issue is not super common. Does it happen? Yes, but it's not super common. Not as common as just Aspergillus infections are. These pictures that I have for you guys here, these are pictures, you can see the little photo credit down at the bottom from where I got them, but these are the Aspergillus fumigatus species that we see most commonly being a problem causing the disease Aspergillosis. And the little head here, this is like the little stalk with little spores and everything. Okay, so really, the question that we should think about is, well, we know that Aspergillus fungal spores are everywhere, but why doesn't every bird get the infection then, right? Because yeah, it's out there, it's common, it's a ubiquitous organism, again, meaning it's everywhere. But why doesn't every bird get it then? You know, if I'm sitting in this room and I have Aspergillus fungal spores in here, why are birds that are walking into this room not getting it? Or in people's individual homes where we know there's Aspergillus fungal spores, why are birds not getting it? Well, it's because really we probably need to have a bird with an immunosuppressed health state in order for that infection to really take hold and be a problem. Because what should happen in a healthy individual is a healthy individual probably is exposed, just like we are sitting in a room, is exposed to some fungal spores. They should be able to inhale minimal amounts of fungal spores. Again, if it's not a damp environment where with poor airflow, where, you know, it's a little bit more of a clean environment, good airflow, it's not damp, things are dry, where there's, you know, not a huge amount of fungal spores, you're going to be breathing some in. Why are you not getting infection? It's because you're in, hopefully, a good healthy state and not immunosuppressed. It's when an animal is immunosuppressed, that's when their immune system isn't able to keep things in check, and you're able to get this infection develop. Then when the immune system is not, you know, surveying the body and identifying, oh, here's a little spore, let's get rid of it. When the body isn't doing that, then those fungal spores are able to start to populate an area, overgrow, then cause a true infection and cause problems. So this picture of this African gray here, you can see this bird may be in a little bit of a immunosuppressed state because it's stressed. Like this bird is dealing with some other health problem. But not only is it dealing with this other health problem, it's in an e-collar, which is not always the most fun thing for a bird to have to be in. Its feet are bandaged. It's in a different cage. There's many things that are causing a little bit of stress, a little bit of stress, a little bit of stress. All that stress can compound and potentially put this bird at a little bit of an immunocompromised state and maybe make it predisposed to developing an Aspergillosis infection. So when we have a bird that gets Aspergillosis, they're in this immunocompromised state, it's just sort of the perfect storm that allows for them to be able to develop infection. How does the infection truly cause disease? Well, I made this little sort of flow chart for us here. Normally, it likes to get into the airways. And when it gets into those airways, it can attach inside those airways, it will grow and it'll replicate. When it does that, it starts to form these plaques. These plaques that are in these airways are going to lead to obstruction of airflow, because normally you have this like open airway, this open tube that air is flowing through, but you start to develop like a plaque in it that is sort of making that airway more narrow. Now air isn't going to pass as easily. Now, if that's really mild, if the narrowing is kind of minimal, well, then you may have a bird that's completely asymptomatic, because if air is able to pass through just an area where there's a teeny tiny plaque, everything may be flowing fine, air may be flowing fine, and with air flowing fine, well, the bird's able to breathe just normally and not have any issues. But if that plaque is really thick, if it is, more severe, it really could get to the point where it either almost completely blocks airflow. So you're taking this normally large diameter area for air to flow past, and if you reduce that by 50%, well, that's going to interfere with oxygen getting lower down. Or it can be so severe that you can get to the point where an Aspergillus plaque completely blocks that airway. And if you block an airway completely, well, then everything downstream of that area where the blockage is isn't going to be getting any oxygen the way that it's supposed to. You're not getting airflow to the lower parts of that respiratory system. And if you're not getting airflow there, well, that's a big problem. If we have a complete blockage or partial blockage with the airway with a plaque, it's going to impact their ability to breathe, which is going to lead to poor oxygen delivery to tissues, right? Because oxygen is what's trying to get through that airway system down into the lower airways to go do gas exchange with the blood. So not enough oxygen is going to be delivered. Also, we're not going to be getting rid of waste like CO2. CO2 waste from the tissues should be being breathed out, and that might not be being breathed out as well as it's supposed to. And so that CO2 level may rise. We could start, because we're not having enough oxygen, we're having too much CO2 in the tissues, that starts to impair cellular functioning and metabolism. And then ultimately it ends in death, because if you have impaired cellular functioning and metabolism, when those cells aren't going to be able to survive, the cells start to die. If you have multiple cells affected in an organ, well, then the organ isn't functioning appropriately and can lead to death. Now, as I had mentioned previously, sometimes those plaques are small and they don't always obstruct airflow. So sometimes this sequence of events isn't happening, yet the bird is still sick. And that's when that Aspergillosis infection is causing inflammation. So you may not have a complete plaque that's severely blocking or completely blocking airflow, but usually the body starts to go, wait a second, something's here that's not supposed to be here. Even if you're in an immunocompromised state, the body still is trying to do its job. And usually it's going to cause a bit of inflammation to go to the area where you have these plaques. Now, inflammation is helpful of course, because it is trying to deal with an infection, but inflammation, if it's not able to completely resolve that infection that's going on, well, then sometimes you get more inflammation and more inflammation. And now that inflammation in and of itself starts to become a problem, because the body starts doing all these mechanisms that it normally would be trying to kill off organisms, which then can lead to more cellular death and plaque development and just furthering the issue. And that inflammation now in and of itself, which was supposed to be helpful, becomes a problem. In rare cases, the other thing that can happen is sometimes you can have those Aspergillus spores get into the bloodstream and cause what is known as septicemia. So that means infection within the blood. And when it gets into the blood, then it is now circulating around throughout the body, through the vascular system, and can get to different tissues and organs. When you get to different tissues and organs, depending upon where it decides to seed out, and start causing overgrowth, infection, and everything there, or a horrible inflammatory response, that can lead to rapid demise and death of a patient. And I can think of a patient that I had early in my career of a red-fronted macaw that was, reported as doing great, everything was fine, and then it was suddenly just acting sick one day. It came into the hospital, it declined rapidly, and it passed away. And ultimately, we found that the reason it had such a rapid decline was because it had become septicemic from an aspergillosis infection. It didn't get to the point where it was having any sort of respiratory signs like one would expect with what we previously mentioned of it getting into the airways and replicating there and blocking that respiratory system. It had just gotten into the blood, caused widespread inflammation, and then organ failure and rapid death, which is very sad. Now, that form of septicemia with aspergillosis is not super common, but it can happen. So what sort of birds are predisposed to this? And then we're always, talking about pet birds here. I specifically want to focus on which pet bird species are the big problem. Now, this infection can happen in any species. It's not that certain species are never going to have this happen. It's just that there's certain species that it's just not super common in, and other species that it's more common in. And I have them listed there. The more commonly infected pet birds that you'll see with aspergillosis are the African gray parrot and the Pyonis parrot. Groups of Pyonis parrots, because Pyonis is several different species. But those guys are the ones that are known to be a little bit more common to have aspergillosis infections. Versus the budgie, we really don't see it much in the budgie. So that's good for our little budgie friends. Not impossible, again, for them to get it. It's just not one of the diseases that really is common in them. I don't have a good answer for why it's not so common in them. Just that, yeah, in them, we really don't see it too frequently. So what are the sort of signs that we're going to see? As I mentioned, with how the disease process occurs, really the main thing is going to be some sort of respiratory problem, because you're developing plaques and inflammation in the airways. And when your airways are having problems, usually it's going to result in the patient showing some sort of respiratory sign or symptom. So respiratory distress can be seen as a tail bob, as one of the things at rest. The bird's just sitting on a perch, relaxing, and you see the tail sort of pumping up and down, sort of heavy. That means that bird's working hard to breathe, because they're just taking deeper breaths, and in that deeper inhalation that they're doing, inhalation, exhalation, they kind of move their body a little bit more, and it just causes that tail to pump, because they're standing on a perch, so they're balancing a lot, and so it just kind of alters their balance a little bit, so they're wobbling that tail back and forth to maintain balance on that perch. Okay. Now, if a bird just took a big flight around the room or did some, extraneous exercise, and then it lands and you see a little bit of tail bob, that's okay. There's periods in time when a bird is okay to be breathing a little heavier. And again, exercise is one of those times, so that's all right. Tail bobbing, isn't completely an abnormal sign, you really have to look at the context in which tail bobbing is happening to know if it is a problem. And if it's at rest, that's when it's a problem. Other thing is open beak breathing. So I put this picture of my macaw. She wasn't actually having open beak breathing, but you can see she's kind of demonstrating what a bird might look like with open mouth breathing, where her head's kind of tilted up and her mouth is open a little bit. When birds are having difficulties breathing, just like any animal having difficulty breathing, usually try to open your mouth more and really inhale a big gulp of air to try to get oxygen down into your lungs and thus into your tissues so that you're doing okay. And so when birds are breathing really heavy, sometimes they're really like stretch their neck out. Remember that when a bird is just sitting, relaxing and resting, it often has its neck looks a lot shorter than it actually is because those feathers cover everything up. But normally their neck kind of rests in this sort of like S-shaped sort of curve. And when they're working hard to breathe, they'll stretch that neck out a lot because that helps make the trachea extend out and be more like linear as opposed to kind of kinked up with the normal way that they hold their neck. And then they're able to take in a lot deeper breath, hopefully with that head sort of extended, and then opening that mouth or beak really well to get in as much air as possible. The other thing that may be seen is exercise intolerance. So the bird is just having, not as great of an ability to do its normal behaviors. When you have birds who are flyers that normally fly around quite a bit, are really good little athletes. And then they maybe start doing some of their exercises, but then they get winded. So they need to like stop, not fly around as much, take more breaks. They seem to take longer after they have flown around and are breathing really heavy to get back to normal. Or sometimes they just don't want to do their normal exercise of flying around or being active because they just know that they don't feel great. They don't have the energy in them to fly around and know that their oxygen demands are higher when they are flying. So they're just going to go, you know what, I'm going to sit around because I don't feel really good. I can't breathe really well. It's better to just sit and relax. So that would be defined as lethargy. They're just sitting there, not doing much. Other signs that they might show is anorexia. They're just not eating great. Some birds, when they're feeling crummy, even though it may not be the gastrointestinal tract that's the problem, they may just not want to eat because they just don't feel good all around. I mean, it's just like some people, when some people get sick with the cold, sometimes they're just not interested in eating. Versus, some other people are fine eating when they have a cold. And that happens with our birds too. There's some individual birds who they don't feel great, but they're still eating okay because it's just not affecting their appetite. So depends on the individual whether or not you're going to see any level of anorexia. They may also just be fluffed, which is the annoying typical sick bird problem, that a bird is just fluffed up, not moving around as much, quieter, but that fluffing of the feathers is just non-specific. It's just a bird trying to get comfortable. You may also have weight loss. Even despite a good appetite, they might have weight loss. The reason for weight loss is because the body is trying to deal with this infection and it's causing a lot of inflammation and it's trying to clean things up. And so the body is kind of working overtime as opposed to just the normal, standard metabolic rate. It's really trying to work towards cleaning up this infection, and therefore energy demands increase. So they may still be eating the same volume of food, but they're dropping weight because they're burning through their calories more rapidly. And then sadly, the other thing that is sometimes seen is sudden death. And as I mentioned with the septicemia, that can happen very quickly. But also, if you have a plaque that is growing, but airflow is still able to get around that plaque, and then it grows to the point where it completely occludes airflow. And if it's in a really important area, like the trachea, and now you suddenly have no ability to get airflow down into the lower respiratory system, that can result in sudden death. So a bird can be acting totally fine because they're so good at acting like everything's okay when it's not. Stuff is slowly growing in there, gets to the point where it completely occludes that trachea. Now you can't breathe, and now they're going to rapidly pass away because they cannot go for very long at all. We're talking seconds without taking a breath. So unfortunately, sometimes that's just what happens as a bird is suddenly found dead. Now, how do we diagnose aspergillosis? Because say we have a bird that comes into the hospital that is showing some of those signs that I mentioned, respiratory distress in some way, just being fluffed and lethargic. What do we need to do to figure out that the problem that the bird has is aspergillosis? Well, it's usually going to involve some diagnostics, just like any other disease or problem we're trying to understand and diagnose. One of the things that we can do is just basic blood work. Our basic blood work is usually a CBC and a chemistry. The CBC is called the complete blood count, and it's looking at the red blood cells, the white blood cells, and then the thrombocytes, which in mammals are platelets. When we have an aspergillosis infection, because it's an infection, what most commonly happens is you're going to see an increase in the white blood cells because there's an inflammatory response. Those white blood cells are part of the immune system that when they recognize that something's wrong, they're going to increase their numbers to cause inflammation to try to deal with the infection. Now, I will say not 100% of the time will that happen. There definitely are cases where you have an aspergillosis infection and they don't have a high white cell count, whether that's because they're immunosuppressed or maybe it's been going on for a while and they've used up a lot of their white cells, or maybe it's a more mild thing and just hasn't caused a real major inflammatory response yet. Could be any of those reasons. But one thing we are looking for on our CBC panel is a white cell count increase. Now, we usually run the chemistry panel at the same time. There aren't any classical changes that we're going to see on the chemistry panel that are going to be associated with aspergillosis. We might see other problems though. We might see like increases in liver values if the liver is somehow affected associated with this. We also will sometimes run certain protein levels on birds. Usually it's called a protein electrophoresis, or EPH is the other name for it, where we're looking at different types of inflammatory proteins that will go up when you have an aspergillosis infection. There are certain globulin proteins that will increase. The beta globulins, the gamma globulins will increase when you have an aspergillosis infection. So that's what we're looking for on blood work to key us into, could we potentially have aspergillosis as a problem? Now, none of those changes on the CBC and chemistry are what we call pathognomonic for aspergillosis, meaning like that's the only thing that causes it, because other types of infectious diseases can cause a high white cell count. Other types of infectious diseases could increase certain inflammatory proteins. So, but that may be something if we have a bird that's coming in that's just like lethargic, fluff, not eating great. We may initially run those tests, find a high white cell count and go, oh, geez, this could potentially be aspergillosis. Let's do some additional tests to try to find out what's going on. So then the next thing is radiographs or a CT scan. I put those together because they're both imaging studies. The picture that I have right here, this is Dr. Pilney, and this is, I believe, Dr. Gilbert, one of our other doctors, looking at a CT scan of a bird. This is one of like the 3D rendered images. And you can kind of see the bird's ribs on the image. This is its keel bone over here, and all this like I guess sort of orangey stuff that you can see over here. That's actually highlighting the blood vessels that are in the lungs. So they are able to kind of look up at the lungs area on our images. A couple other views of the bird in just like different planes to see where things are. On this image down here, the lungs are actually these little triangular things that I'm sort of outlining. But we take images to look at the lungs, look at the air sacs, sometimes looking at the trachea to see if we can see any plaques that are developing in that respiratory system, because it can happen anywhere in that respiratory system. can happen. And again, the trachea is kind of really bad because, I mean, well, you only have one trachea. And if that gets a plaque in it, you're not getting any oxygen further down at all. But you know, if you have a plaque in like one part of the lung, well, okay, then maybe the other lung is functioning okay. So yeah, it's not great that you're having a plaque in this one lung. This one lung is having a real bad problem, but maybe the other one's fine. Or sometimes you really have plaques throughout the air sacs, which usually the air sacs aren't getting obstructed with airflow. It's just the fungal organisms like to hang out in there, and the air sacs don't have great blood flow to them, so the immune system isn't as able to like get to those air sacs to try to clean things up. So things can sit in the air sacs for quite a while, and be just like a constant source for infection if we're not dealing with it down there in some way. Other more specific tests. Now, let's say we do blood work and we saw an inflammatory response. Go, this could be aspergillosis, and we took some images and we saw a plaque somewhere or a change that made us think, oh, that could be an aspergillosis plaque in there. But it could also be a plaque of bacteria or something else. What other tests do we need to do to be more specific in our diagnosis of aspergillosis? Well, there is a blood test where you can do an antigen and antibody test. Antigen tests are looking for certain things from the organism itself that are in the bloodstream. And not all cases of aspergillosis are going to have infection in the bloodstream. So sometimes the antigen test isn't going to pick something up when something is actually there because, hey, the aspergillosis in this individual didn't get into the bloodstream. The antibody tests are the individual's immune response to aspergillosis. So if the body has seen aspergillosis, a healthy individual should create antibodies in an attempt to try and clean up that aspergillus organism. So the antigen test, as I mentioned, isn't perfect because you have to have organism in the blood in some way for it to be a problem. But the antibody test also isn't perfect either for diagnosing aspergillosis, because if the bird has had a good immune system and it saw aspergillosis, it could fight that infection off, and maybe it has developed antibodies to the infection, but it doesn't actively have the infection. So that particular test, it's good and I like it and I use it, but I also have to recognize that I have to be a little cautious with my interpretation of it because it's not perfect. It's good, but it's not perfect. So the next things that we can do is to truly diagnose it. We can take cultures and do cytologies of plaques, but we need to get to those plaques, right? And those plaques are usually like in the trachea, the lungs, or the air sacs, right? So I somehow have to get to that part of the body to be able to get a sample to do a culture for aspergillosis, or to do a cytology sample that I can see those aspergillus fungal spores like I showed you on that first picture. In order for me to get to those areas, one of the ways that we do that is we do endoscopies. So an endoscopy is where you're using a scope that you're putting into a body area to have a look around and also be able to take samples. So I can actually put a scope down the trachea to look down the trachea and see if there's any plaques down there. I can also put a scope into the side of the body. And so like if we look at this CT image here, this is again a bird. Its head is up pointing towards the ceiling. Its feet are pointing towards the floor. These are its ribs. Its wings are pulled out, so like you can't see the wings in this image. But this is the keel over here, and like sort of this area is the abdomen. I actually can take a scope and put it down into this area, like right over the abdomen or even between the ribs, to get into an air sac space and actually have a look around and look in those air sacs, or even get right up to the lungs and look for any sort of plaques that I might then be able to take a sample of and do a culture or a cytology of to get a more definitive answer of if this is aspergillosis. Because there are other organisms like bacterial infections that could potentially cause plaques too. And, you know, we really need to take samples to know specifically what we're treating, because different infections are going to require different types of medications to be treated appropriately. So I have a couple of pictures for you. This is an endoscopic view of an air sac with one of those little plaques. It's at the point where it's developed into a granuloma, which is basically like you have the aspergillus organism, the immune system tries to fight it off. And so you get all these inflammatory cells that go around those little aspergillus spores and the aspergillus organism, and get this, what's called a granuloma, which is just this area of like inflammatory cells, organism, and then also dead necrotic tissue, because what are those inflammatory cells doing? They're trying to kill the fungal organism, so you get some dead cells and everything in there too. But to orient you guys to what this image is actually showing that you're looking at. So this is a screen that when we place the scope down into the air sac, and this one we've placed it into the air sac on the side of the body wall. I am now down into like the abdominal area in the air sacs, having a look around, and this sort of like pink thing up here, that's actually lung tissue. And the like white hazy thing that's over the pink area, that's air sac. Now, normally a healthy air sac, I should be able to see through it and see that pink tissue behind it easily without any sort of problem, because air sacs are very, very thin. People will say you should be able to read the newspaper behind an air sac. And I can't see that normal lung tissue as easily as possible. It's just kind of this hazy appearance because this air sac is inflamed right now because of an infection with aspergillosis. So it makes it end up being thicker, gets edema, which is fluid kind of develop in it. The blood vessels get a little bit more thicker and prominent. And you can see this sort of circle right here in the center. That's that little fungal plaque that's had inflammatory cells around it and is turned into a granuloma sitting right on top of that lung. So I can actually, while I use my scope, put a little working tool right next to the scope that I can use to grasp that little plaque and take a sample of it, and then we can culture it, look at it under the microscope and see if it is a fungal spore or if it's a bacterial plaque. So how do we treat aspergillosis? Well, because it's a fungal organism, we want to put them on an antifungal. Now we have lots of different antifungals. Well, I shouldn't say lots, but we have a few different antifungals that are available to us. There's certainly way more antibiotics on the market than there are antifungals, or say antibacterials on the market than there are antifungals. But we do have some to choose from. Now, not all the antifungals that are available to us are effective against aspergillosis. So we have to keep that in mind and select ones that are effective against aspergillosis. And I have several of them listed here. So historically, itraconazole was the main antifungal that people would use. And it's good. It's effective. But certain species may be more sensitive to it. Interestingly, the African gray parrot may be a little bit more sensitive to itraconazole. They can have what's called an idiosyncratic reaction where some will do just totally fine on it, no problems, and others seem to have a toxicity from it. Now, we have to keep in mind that our antifungals, they're trying to kill fungal organisms, so they are toxic to in their own way, because what are they doing? They're killing these fungal spores and fungal elements that are in the body. So they have the potential to also cause toxicities to whoever's taking them too. So they're not without their own risks, but absolutely, if you don't treat an Aspergillus infection, the bird could die. So we have to understand that we're taking some risk with medications, but usually they're going to be on these medications. They're going to be on them for a period. They may need other supportive care while on these medications, but the goal is for them to not be on these medications long term. The goal is they're on these medications for the period of time that is required to treat the infection, and they're going to be done with them. Another newer medication that's been used more and more recently is voriconazole. Interestingly, some believe that maybe the cockatoo is more sensitive to voriconazole, or we think of the African gray as more sensitive to itraconazole. Maybe the cockatoo is more sensitive to voriconazole. These are things that people have subjectively seen in patients, but we need more data to really say how sensitive these different species may be to these antifungals. So it's just something to keep in mind for the veterinarian is thinking about when they're working with their patient that they diagnose this disease, and which of these antifungals am I going to use to most effectively and safely treat my patient. The other thing is terbinafine. Terbinafine is interestingly in the studies, it doesn't always show great efficacy, but I have to say subjectively, when used with patients, it seems to actually have some good benefits. So it is another one that if your bird gets diagnosed with this disease, your veterinarian may be saying, hey, let's try terbinafine. Now, sometimes the itraconazole and voriconazole fall in one particular class of drug, and the terbinafine falls in a different class. They work slightly differently. And so sometimes we may actually be using terbinafine in combination with either itraconazole or voriconazole, depending upon how bad the infection is in a bird. We also can do nebulization treatments, and nebulization treatments are where a bird sits in like a little chamber and inhales air that is getting pumped into there, that's humidified air, and also can have antibiotic in that humidified air, like pumped into this little chamber. So they're basically sitting there breathing in the medications, which is great because we know that the main way that this particular infection is causing problems is in the airways, right? So if they're sitting in this chamber and they're inhaling the antifungals, well, then it's getting into the nasal passages, the sinuses, the trachea, into the lungs, and down to where it needs to be to really try to topically have some efficacy. And those aren't really getting systemically absorbed. We can use terbinafine again in that way, but there's a couple of others that can be used. Amphotericin B, which we actually talked about last month, because amphotericin B is sort of the treatment of choice for avian gastric yeast. We can use it as a nebulization agent in treating Aspergillosis infections. Another thing is clotrimazole, and you'll hear about a couple of other ones out there. This isn't a exhaustive list, so there's other options your veterinarian may talk with you about, but usually some systemic antifungal and possibly combining it with a nebulization of an antifungal as well. Also, birds may need some additional supportive care. And what that often is going to look like is oxygen therapy. Again, if those airways are narrowed pretty substantially, that bird may need to be sitting in some oxygen, where a more concentrated environment with oxygen, so that it can get breaths a little bit more easily. They may also need to be on anti-inflammatories, because remember I was saying that part of the problem is the inflammation that the body causes in an effort to try to fix the infection. And sometimes it's just a lot of inflammation that's going on, and it's a little more than what we really need. So anti-inflammatories may be helpful as well for some of these patients. And then sometimes they also need some antibacterial antibiotics as well, because there might be a secondary bacterial infection. Because when you have this infection with this disease, this fungal organism that's causing all this inflammation, well, there's other organisms in the body too, other little bacterial organisms that, again, the immune system is supposed to be keeping in check. But now if the immune system is so focused on dealing with this Aspergillosis infection, maybe some of those bacterial organisms are going to kind of latch on to where the inflammation is and also start to cause another secondary problem. So some of these birds need antibiotics as well. Keeping in mind that sometimes if you're on an antibiotic, it can make a fungal infection worse, but you sometimes do have to have the two of them together to truly get a patient through this whole process because of secondary infection. So I say that more because I want to make sure they're not used in every single case, but sometimes it is going to be appropriate to use them. Other supportive care that may be necessary is actually having an air sac tube placed. So again, if we go back to those plaques, if a plaque is obstructing an airway, so you're not getting any completely obstructing an airway, so you're not getting any airflow further down, or you're getting the minimalist amount of airflow further down from where the obstruction is, if that happens in the trachea, the wonderful thing about birds is we know that birds have their trachea that leads down into their lungs, and then their lungs attached to their air sacs. And there's a whole, circulatory way that air flows through the trachea, lungs, air sacs, back through the air sacs, back through the lungs, out the trachea. If there's an obstruction in that trachea, we can actually put a tube, an air sac tube, into the side of the body, into an air sac. So now we can bypass that trachea that may have a big plaque in it, start treating that plaque, getting them on the appropriate medications, and now they're breathing out of the side of their body, which is really kind of cool, and a wonderful thing that is unique to birds that we can do, because mammals don't have air sacs that we can, put a little tube into to breathe from the side of their body. This picture here is of a little cute young green cheek conure, and you can see this little orange tube here that's kind of tucked underneath the wing. And in this image here, you can see a little bit more how it's like coming out the side here, tucked underneath that wing. That was a little green cheek conure that had come in with an aspergillosis infection, and he had an obstruction in the trachea. It wasn't a complete obstruction, but it was very near complete, to the point where he was just gasping to breathe, was not doing well. And we placed this air sac tube so that, okay, now he can breathe fine because he can breathe through the side of his body, and we can get him on the medications that he needs. These can actually be left in place for a couple of weeks if needed, to allow them the time to start having the infection be treated. Once that trachea is patent, and meaning open and clear again, then they can have that air sac tube removed. Just a couple more pictures of this cute little guy, because he was just a great little bird. When he first came in, we originally put him in an oxygen chamber. So this picture here is a picture taken through the cage wall, sort of into the oxygen chamber. And you can see, like, he's in the corner. He kind of has his head up, and he's not as dramatic in this photo as he was acting at some other times. But his eyes are closed. He's just acting like he does not feel well. Once we place that air sac tube, here he is in his little sort of post-procedure hospital tank. He was in just a little, like, 10-gallon fish tank with a little towel on the bottom, easy access to food, water, toys, and stuff. You can see he's happily sitting down here eating some pellets, and that tube is just sitting out the side. He's breathing through the tube on the side of his body. So, and birds can even go home with air sac tubes if it's appropriate. The question that we often will get is, well, is the bird going to pull the air sac tube out? And while they can pull the air sac tube out, it's very interesting that the vast majority of them quickly learn to not touch the tube. Because we place these under anesthesia. So the bird is put under anesthesia. It's like a very rapid thing, because the bird's usually having respiratory distress. So, we tell the owners, hey, we need to place this air sac tube. This is a life-saving measure that we need to take. But we got to put them under anesthesia for a second, place this tube, and we're going to wake them right up. When they wake up from anesthesia, they're often going, oh my gosh, I can breathe. This is great. And then they may turn around and look at the tube and go, what is this thing that's coming out of me? And then if they touch it and they occlude it, then they quickly go, oh my God, I can't breathe anymore. And they stop and they let it go. And they're like, oh, I can breathe. So they often rapidly learn, don't touch the tube, because if that's what I'm breathing out of right now, if I touch it, I'm not going to be able to breathe. So the vast majority of these birds actually leave this alone. Now, every once in a while, you get somebody who doesn't learn that lesson rapidly, and yes, they try to pull the tube. Okay, those guys need to be in a cone so that they don't go back and bother themselves. But here's just a picture of another patient. Now this bird, I will full disclosure say, it did not have an aspergillosis infection. This one actually had a plaque from a bacterial infection, but it was still the same situation because it was in the trachea. So this bird, we placed its air sac tube. You can see the tube coming out of the side there, but look, she's happy, she's eating. She doesn't care that she's got an air sac tube in, because she can breathe. And that's, everything. When you're able to breathe, you're alive. So they often do pretty well. Now, so say we have a bird come in and we diagnose it, we get them on the appropriate treatments based on the individual differing levels of supportive care. What are we looking for in the future for these birds? Well, these birds, this is not something that is a quick treatment. This is something that usually takes a few months to treat them. I've even known some birds where it's taken upwards of a year, to get these things under control, because sometimes the infection is really severe. If those air sacs are really affected, well, again, air sacs don't have great blood vessels flowing to them, so it's a little harder for antibiotics to get to there. So sometimes they'll sit in there for some time. They need a lot of nebulization treatments to really break that stuff up. So this is not a quick, you're on antifungals for 2 weeks like we are with antibiotics and you're going to be done with this. No, we're usually saying this is going to probably be at least a month to 3 months to maybe longer than that. And it is going to require follow-up blood work and follow-up imaging. Imaging, because whatever imaging we did, whether it was x-rays like this picture of this bird here, or a CT scan like the image they were looking at before, if we found a plaque somewhere or changes somewhere, we need to follow that same imaging to really see how things are going. Are we resolving those plaques? Are we resolving maybe the thickened air sacs, what have you, to see if things are truly improving. Also, the reason we need to do blood work is because, hey, if they had a high white cell count, we want them to be on medications until that white cell count normalizes, or those inflammatory proteins that were elevated are doing better. But also, because we're on usually these systemic medications like itraconazole or voriconazole, and they have the potential to have side effects, particularly on the liver, we need to be monitoring those liver values to make sure that we're not having any other problems occurring. Because if we do, well, then that's not appropriate for that individual bird, and we need to switch it to maybe a different medication or alter the dosing or do something a little bit different for that individual. Now, birds can recover. They can do well. I have had some good experiences with birds with aspergillosis. On the flip side, I started this off with saying how I had a patient who came in, it declined rapidly and it passed away. Birds will die from aspergillosis. This is not a thing that we take lightly. This is a serious infection, and they do require quite a bit of medical care. And there are some birds that do come in and they are really advanced, or they become septic, or a plaque develops in the wrong spot really rapidly, cuts off blood flow, and the owner may not even have enough time to get to the hospital, because you don't have a lot of time when an airway is obstructed before an animal passes away. So yes, birds do pass away and birds will die from aspergillosis. But if we can catch it and we can get them on appropriate medications and support them through it, they can do well. I will also just note, working with wildlife, we do see this with some frequency in wildlife as well, because, you know, being a wild animal in captivity, you know, you got injured in some way, you come into captivity, it's a stressful thing. It's easy to get become immunocompromised and potentially get a secondary infection like this. So we have to deal with this in wildlife as well. And again, sometimes they recover really well, and sometimes they decline. So you know, something that is a serious problem, but something we always do our best to try to help these birds through. So that's the end of my talk. I've left time for some questions, but I love this photo because this is a pet chicken that came in, and it came in one of these cool new, like, I think these are more designed actually for cats as a carrier. It has like this little bubble on the front that the pet can look out of, but they have their chicken, and it's a chicken version one, right? Or a bird of some sort. But this little guy, he just looked like such a little astronaut to me, looking out from his little rocket that he's going to be blasted off into space in. So I don't know, I just thought it's a cute photo. So with that, does anybody have any questions for me in the last little bit of time?
Yes, we do. Question is, does having aspergillosis as a baby bird affect health in later life, now that they're 30? Like,
you know, it depends on if they had any secondary problems with maybe being on the medications, like if there was any like liver problem associated with being on the antifungals, then yeah, you could potentially have some longer problems with your liver, you know, that may be a long-term issue. But I wouldn't say that, at least that I'm aware of, that there's really any difference in the potential for something like that, long-term effects versus no long-term problems, in a baby versus adult. I don't think that there's really any age-related difference. Like, a baby is more likely to have some long-term side effects versus an adult bird in the same situation later on down the road. It's really more, how bad was it? What were there other problems associated with it? Did the medications have any side effects? What have you?
okay. Okay. And then do sunflower seeds in the shell contain aspergillosis and its toxins? And also, are corn cobs a risk factor for aspergillosis?
Yeah, so I'm unaware of sunflower seeds being a problem with Aspergillus spores inside of them. I guess, is it possible that you can maybe find one out there somewhere? Probably, because again, it's ubiquitous, it's everywhere. So if stored inappropriately, sure, but it's not that they're not well known for them, you know, the way that like people think of peanuts with it being in the shell. As far as, what was the second question, second part of the question?
Um, okay, so first one's about sunflower seeds in the shell, if it
Oh,
contains
the corn
aspergillus.
cob.
And the
The
corn
corn,
cob, is corn
yeah,
cob a risk?
corn cob, it has a little bit, I would put corn cob at a little higher risk than sunflower seeds. And again, usually if it's sunflower seeds, it's usually going to be more that it got contaminated, damp environment, poor airflow, kind of sitting there, and you got some contamination. Corn cob, a little bit higher for there to be a problem. If things are dried, if things are aerated well, you know, like sometimes you'll have like corn cob thing as a part of a bird toy. I think those are pretty minimally likely to be a problem.
Okay, kind of a related question. Let's say you keep rabbits as a pet with your, and hay, like Timothy hay or the kind of hay, or can
Yeah.
that be a source of any, like hay, you're supposed to keep it air so it doesn't get moisture?
Yeah, it's I mean, I have plenty of people who have parrots and rabbits. I myself have had rabbits in the past with my parrots, and thus had Timothy hay. I don't think it's a huge risk. The biggest risk is if that hay gets moist, you could potentially develop fungal spores growing in there, but then it's really probably more the problem for the rabbit than it is for the parrot. So,
Yeah.
you know, you don't want to feed moist hay to your rabbit either.
Okay, sorry, a little off-topic question, but okay.
Okay.
Okay, so someone asked if we don't have access to CT or endoscopy, can they still confirm it via like observed nodules and X-rays, for example?
Yeah, I mean, they can be, well, it's not confirmed, but it can be highly suspicious. So like, yeah, if you don't have the ability to do CTs and endoscopies and get those cytology samples and all of that, that's okay. You know, not everybody is able to get to places that have that sort of stuff. So, okay, you're gonna look at your blood work to see what is my white cell count doing. You're gonna look at x-rays and say, hey, maybe there's some weird nodules on there. There's a bright spot over the lungs or the air sacs that this could be aspergillosis. And then maybe we would want to do also the aspergillus antibody and antigen titers. And we look at how high those values are to help us tell, like, am I really suspicious? Also the inflammatory proteins, are these elevated? So like if all these blood changes and radiographic changes kind of fit the bill, like, can we 100% confirm it? No, because the only way we can truly confirm it is have that sample, but we can be highly, highly suspicious for it, put them on the appropriate medications. And if you've got an appropriate response to the medications, awesome. You know, we do have to make assumptions like that sometimes, because sometimes for whatever reason, we aren't able to do all the diagnostics that we would like to.
Okay, and then so we have a question from a viewer who unfortunately lost two grays to
Oh.
Aspergillosis infection years apart, 20 years ago. So sorry to hear that. And they want to know what, in your opinion, is with the most updated information, is the best antifungal to treat Aspergillosis in a gray and the delivery of the meds.
Yeah.
Have we come far since, like, say, 20 years
Better,
ago?
better than 20 years ago, yeah. I mean, voriconazole is a newer antifungal. It wasn't really in use, you know, 20 years ago. So in grays now, it would be voriconazole is probably your number one. And then even though the data doesn't have as good a support for terbinafine, I have to say I like it. I know plenty of other vets that like it too. And so that, whether it be through nebulization of terbinafine or adding that on in addition to the voriconazole for an African gray, is probably the best thing that we have right now.
Okay, and then I guess our last question, if you don't mind.
Sure.
Okay, so are wild birds as susceptible as pet birds and chickens? So wild birds, chickens, are they more susceptible, less susceptible?
I would say I see a lot more aspergillosis infection in wild birds than I do in pet birds. Now, part of that is probably going to be based on where I live. Living in Arizona, a very dry environment, we do see aspergillus infections, but we don't see it as much as like when I was doing my residency, which was out on the eastern portion of the United States, on the East Coast. You know, I saw it more there than I see it here. But I definitely see it more in wildlife here than I do in pet birds here. And I think it really goes back to that immunocompromised state. They're stressed. They definitely do not want to be in captivity. Stress can contribute to an immunocompromised state, along with whatever else is going on with them. So therefore, we see it more in them. As far as chickens go, so I deal with backyard flocks. I'm not dealing with chickens in the industry in any way, so I can't make any comments on that. But as far as backyard flocks go, I feel like we see it more in parrots than we do in backyard hens. We do see it in backyard hens, but it would go like as far as like levels of who gets it the least to the most. I would say chickens, then parrots, then wildlife, from least to most.
Okay. Okay. Interesting. Wow. Okay. That was fascinating. And I'm glad that you pointed out the two, because I was curious as soon as I saw that, like, is the bird going to pull it out, or because it's something
Yeah.
figuring out. That's amazing that they kind of figured out, like, that it's safe, that it's helping them instead of hindering.
Right. Right.
Okay. And then, okay. So, let's see. I have to announce today's giveaway winner. Sorry. Let me see. Okay, hold on one second. And just to announce that today's giveaway winner is also going to get the latest. I don't know if have you tried the apple Nutriberries? That's the newest flavor. So have you tried them? Has your flock? Not yet.
No, I haven't gotten to try those yet. I've heard about them, but I haven't gotten to try them yet.
That's how new they are. They just rolled
Yeah.
out. They just rolled out recently. They're finally up on the site. And the winner today, who's going to get some apple flavored Nutriberries, as well as another Lafeber product of your bird's choosing, that goes to Beverly Lynch. So congratulations, Beverly. You are the giveaway recipient today, and I hope that makes your weekend. Yeah, I mean, just in time for summer, for the hotter month, like apple Nutriberries. I can't wait to see if it smells as lovely as the other special editions have been. So, um, all right, Dr. Lamb, again, thank you. Thank you so much for that deep dive. And this is
Yeah.
great. These deep dives are so powerful, like as far as learning. And the great thing is you can go back and rewatch it and see the slides again, so it can really, hammer home the information. So,
Awesome.
all right. Have a great weekend, guys. Stay safe. All the best in your flock. And next Friday, we're going to be Ask the Vet with Dr. Tully. So join us next Friday. Dr. Lamb, thanks again. Truly
Thanks.
wonderful. All right, guys. Bye. Till next time.
Bye.